Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing health care to the residents of the Washington Township Healthcare District for the past 60 years.
Hello, welcome to today's presentation, Medicare, What You Need to Know, presented by Kristi Caracappa, Health Insurance Information Service Coordinator with Washington Hospital Healthcare System. Kristi has served the Washington Hospital District residents since 2009. She provides information to community members to assist them with making informed decisions regarding healthcare coverage. Please welcome Kristi Caracappa.
Hello, thanks for joining us today. It's nice to see your smiling faces. We're here for the Medicare What You Need to Know presentation. I am the Health Insurance Information Service Coordinator, and thank you, Kayla, for your introduction. So I first want to talk about the service that's provided here at Washington Hospital, Health Insurance Information Service. I'm located here at 2500 in Suite 106, just right in this building. And I'm here all year long to answer any questions you have about Medicare, government programs. Also, there's times where you need to find a physician. You don't know what physicians are in your network. I can help you with that. Also, if you have family members that are, you hear they're needing insurance and not sure what direction to go in, what I can help with is explain what plans are available in the area. Also, you can make an appointment for an in-person consultation. You can do a walk-in. Sometimes I have appointments or other meetings, but it's best to give a call before you come. And I'd love to see you in my office. So our objective today is just to talk about Medicare. Medicare has a lot of different areas and parts and pieces, and we're going to try to break that down for you today. We're also, the reason we do this time of year is open enrollment is coming up. So we're going to talk about open enrollment and what you need to be looking out for. So let's first talk about, for those that are new to Medicare, what is Medicare? It's a federal program that provides health care coverage for those who are 65 and older, those of any age with certain disabilities, and for people any age with end-stage renal failure. And who's eligible for Medicare? Those who have worked 40 quarters in the United States or 10 straight years. That would be your 40 quarters. And those who have paid into Medicare. I'll tell you how you would find out if you've worked those 40 quarters and they're registered. You can go on socialsecurity.gov or call your local Social Security office to find out. Now, how do you sign up for Medicare? You sign up through Social Security. Social Security manages your Medicare, and once you've signed up, then Medicare takes over. So you could either make an appointment at your local Social Security office, or you could go online to www.ssa.gov and sign up there. So if you're already receiving Social Security benefits, sometimes people will retire before they're 65, go ahead and take their Social Security. Typically, Social Security will just go ahead and sign you up with your Medicare card being effective the first day of the month of your birth. Unless you're born on, for example, December 1st, it would then start in November. So if you're not automatically signed up, when should you sign up? The enrollment period for signing up is, the initial enrollment period is, I'm sorry, I got ahead of myself. It's 3 months before your birth month, and 3 months after. That's your 7-month period. So the initial enrollment is when you're first eligible for Medicare, and then there's also a special enrollment period, and then there's a general enrollment period. So let's go through those real quick. Your initial enrollment period is the most common time, and that's when you turn 65. And like I said, it's 7 months, so 3 months before your birth month, and 3 months after. That is your initial enrollment period. If you didn't sign up during your initial enrollment period when you turned 65, we'll talk about why maybe you didn't do that, Then there's a special enrollment period, okay? That's when you're delaying your Medicare Part B. So if you're covered, and this statement comes right from the Medicare handbook, if you're covered under a group health plan based on current employment of your own or a spouse, you have a special enrollment period to sign up for Part A and or Part B. You could sign up for Part A or B anytime you're still covered by the group plan during the eight-month period after your employment or insurance ends, during that 8-month period. And keep in mind, if for some reason you are insured through your employer, you leave the employment and you go on COBRA, COBRA doesn't count as being insured through your employer. You have to actually be employed to you or your spouse to be able to use that, make that your Part B exception. And also VA. If you have, the Veterans Administration actually recommends that you sign up for Medicare, although you don't have to have Medicare with a veteran benefit. The reason you'd want to sign up for Medicare if you have VA is because VA benefits can change. So based on your service. So if your the benefit changes and you need the Medicare, you then pay a penalty for your Part B. So it's just best to have your A and B if you have a VA benefit. So then general enrollment. General enrollment are for those who didn't sign up either on your initial or special enrollment. You didn't realize what the dates were and times, you missed it. Some people just don't understand how Medicare works, and they say Part B does have a premium. So they say, you know, I'm healthy, I never go to the doctor, I'm not going to sign up for Part B until something happens, and then they say, well, I better sign up for Medicare. So you could sign up January 1st through March 31st of each year, and the coverage starts July 1st. And you would more than likely have to pay a late enrollment penalty, which can be pretty pricey, and that penalty stays with you for your lifetime. So you really want to be careful and do this right, okay? Also, you would also be uninsured for at least 6 months if you waited that long. So let's try to avoid that and either do your initial or your special enrollment. Now we're going to talk about the parts of Medicare. There's so many different little parts and pieces, but we're going to break it down, try to make it as easy as possible. So Medicare Part A is your hospital coverage, and Part B is your medical insurance part. So as you see here, this is your card, and that's your original Medicare, Parts A and B. A is premium free if you've worked your 40 quarters, and Part B has a premium that right now it's, I think, in that 160 range, and it's based on what your income is from 2 years past. Okay, so Part A is hospital, B is medical insurance. Now I just want to break that down a little bit. People get a little confused. Part A is when you're in the hospital. If you're hospitalized, you're admitted, not the emergency room, but actually being admitted. That's your Part A. That pays for the building, basically, the food, staying at the hospital. But Part B, when you're in the hospital, Part B does come into play. When the doctor comes in to see you, they are Part B. When you're given medications, oral medications, those are Part B. Any imaging, blood work, surgeries, the anesthesiologist, that's all Part B. So at times people will just take A because they think, well, if I have to go to the hospital. Well, there's a lot of B involved at the hospital. Also, if you're not in the hospital, B is everything else outside. So imaging, your doctors, your labs, and any infused medications, which we can get into later. So you have your A and B, that's where we're starting. Now what else do you need? You need Part D, that is your prescription drug plan. That's where you go to the pharmacy to pick up your drugs or they're mailed to you. That's Medicare Part D. And you do need to have it when you become eligible, or there's a penalty for that down the road as well. And then there's Medicare Part C that throws everybody off. Medicare Part C is an Advantage plan, okay? And we're going to get into what those are. It basically takes over for your Medicare. You still have your Medicare, but the C plan combines Parts A, B, and D together into one plan. So it just bundles it, okay? Now, we're going to go into that. So there's two ways to take your Medicare. You have your Medicare, this side we're going to look at the original Medicare, which is your Medicare card, and then you would want to add a Part D plan also because if you need prescriptions. Even if you don't need prescriptions, you're not taking anything right now, you should still have a plan. There's 34 of them. And then you want something that covers the extra parts of A and B. So Medicare A, although there's no premium, there is a deductible when you're in the hospital, so you need something to cover that. Part B also has a deductible. It's pretty small. It's in the $200 range for the whole year. But there's also that 20% coinsurance. Part B typically pays 80% of your service, and you pick up the extra 20. There are certain exceptions to that, like preventative services. There's a whole list of preventative services that are covered 100%. So again, with the original Medicare, you'd have your Medicare card, your Medicare A and B, you would have a Part D from another company, and then you would have supplemental insurance. I usually recommend people start out with original Medicare and a supplement unless you really know how you want to handle your health care moving forward, and I'll explain that later. With the original Medicare, you could go anywhere in the United States that takes Medicare. This supplement follows. All right, so that's why I usually recommend you take the original Medicare with a supplement. Again, because if you are seeing doctors all over the place, you're going to have to, if you go with an Advantage plan, you're going to have to get into a group. So with the original Medicare, if you're here and you know of a specialist that's in Texas, you can go, as long as that doctor and facility takes Medicare, that supplement follows you anywhere in the United States. So that's a more broad range of health care. Oftentimes we'll have people that will come to see me will have family in another state, and they go stay there for a few months at a time. In that case, I would highly recommend this side. Not that you can't get care in another state in your Advantage plan, just gets a little trickier, and we'll talk about that. Okay, and I might have already talked ahead of my slides, but original Medicare with the Medigap, I'll explain what a Medigap is. It's a supplemental insurance that fills in the gaps in coverage from your A and B. We talked about those deductibles and coinsurance. Medigap plans are sold by private insurance companies that are approved by Medicare. They're lettered A through N because we just don't have enough letters and numbers to deal with. So no matter what company you purchase these plans from, they're the same coverage. Some might have a little added benefit here and there, but the pricing can be different. And so I always recommend you go to a broker that can look at a lot of different companies for you. And then there's not a traditional open enrollment period for a Medigap or supplement. It's not the October 15th. That doesn't count. You pick up your Medigap or supplement when you first enter Medicare, okay, when you're making those decisions. You could change it during your birth month. You could either change companies if you're not happy with the company or the pricing isn't good for you. You could go down in plans, but you can't go up. You can go down. And again, that's done during your birth month. So this is what the grid for the different plans look like. As you see, I've flagged the F, the G, and the N, I'm sorry. So those are the top plans with the most coverage. Some of these have, I think C has pretty good coverage as well, but it's not always sold in certain areas. So Plan F is no longer available if you're new to Medicare. I think it was 2000, if you turn 65 by 2020, that's the last group that could get F. So if you turn 65 in 2020, but you kept working, you could still get it. But if you turn 65 after, your highest plan is Plan G. And as you can see here, it has 100% except for this one little area. That is the yearly deductible for Part B, and that's about in the low $200 range for your yearly deductible. So it's just like F, which covers all the extra parts and pieces to Medicare with that deductible. And then there's Plan N. It has a few holes in it. It's still very good. It covers very well. It's generally cheaper as you get older. If you're signing up at 65, what I've seen is there's not a big difference in premium. As you age, you get to be 78 to 80, you might find that that supplement is getting kind of expensive. You might want to consider moving to N, and an insurance salesperson or broker can help you make that decision. So now we're going to talk about Medicare Part D prescription drug coverage. So Part D drug coverage, so if you have A and B with your Medigap, you do want to get a Part D. There's several plans offered by private insurance companies that are approved by Medicare. You can find these plans on the Medicare.gov website. That's www.medicare.gov. And right now, I believe in Alameda County, there's 34 different plans. Depending on your coverage, you may pay a monthly premium and sometimes a co-payment, and most of the time there's a deductible. And if you don't take in your Part D when you're first eligible to do so, there is a penalty that will be involved when you do sign up. You would sign up during open enrollment, October 15th through December 7th. And again, there would be that penalty. I could tell you, if you're entering Medicare and you're not taking any medications, you should, to avoid the penalty, you should sign up. There's plans as low as $4.50 a month. Because if something happens to you during the year, you know, you may need that. Okay, now we're going to get into the Part C, choosing a Medicare Advantage Plan. We'll talk about the differences and how you choose. All right, so now we're on this side. Medicare Advantage plans, also known as Part C, you have your A and B card, and then what happens when you sign up, they notify Medicare that they're going to be taking care of you. Medicare says, okay, thank you, you're going to take care of this patient. You still pay for your Medicare, you put the card away, and you're going to have a all-inclusive card that's going to be your medical and your drug plan, and some of them offer extra pieces like dental, vision, and hearing aids. There are, I hate to say, I think there's around 20 some plans in Alameda County. When I started here in 2009, there were 3. My job was so much easier, but now there are around 30 plans. And they're sold, also the Part D and the Advantage Plan, they're sold by your zip code. Okay, again, on the Medicare website, you could find these plans. So the big difference between the two, a Medicare Advantage plan mostly works like an HMO. They do have PPOs, but they're still within a group of doctors, the PPOs of where you could go. All right, so I'm going to give some examples here. Kaiser is a Part C. If you're over 65 and you have your Medicare and you join Kaiser, or even if it's through a retirement plan through your company, it would still be a Part C Advantage plan. So basically, Kaiser takes over for your Medicare, okay? And you know Kaiser, right? If it says Kaiser, you can go there. The other plans, for example, there's AARP offers 2 or more now, Medicare Advantage plan. You need to choose a group plan. So for example, in our area, we have Washington Hospital is really involved with HIIS physicians. Palo Alto Medical is more of they actually are their own group. They have an Advantage plan as well. And then there's others. There's Brown and Tolan, and they do sell Brown and Tolan here, but they're primarily Castro Valley and on. So you have to be careful when you're picking them to make sure that your doctors are in network and that it serves you well in your area. So these plans are offered also by private insurance companies, like Kaiser's a private insurance company, AARP, Humana has one, everybody does, Blue Shield, Anthem. Used to, like I said, was 3, now there's 30. You no longer use your Medicare card, you receive a card from your Advantage plan, and they have to cover all the services that Medicare covers. So basically, they have to cover, if you look at the Medicare book, they have to cover that, but they don't have to pay that extra 20%. So there's a lot of holes in a Medicare Advantage plan. You might pay a $20 copay for something, no copay for something else, or they might say you pay 20%. So if you're paying 20%, it's really not covering anything because Medicare is covering that 80%. All right. They typically have a cap, maximum out of pocket. So when you hear that 20%, you know, that could be indefinite. It's not. With the Medicare Advantage Plan, they do have a cap. So we do want to look at that. It's called a maximum out of pocket. And they could charge, each plan could charge you different out of pocket costs with the premium, the co-pays, co-insurance, and they can change each year. So when we talk about open enrollment, October 15th through December 7th, we're looking at Part D drug plans and Medicare Advantage plans. So these are the questions you want to ask when you're choosing a plan. Let's assume that you've been with your employer for a few years and you're really happy with that coverage and you're thinking you want to go with a Medicare Advantage plan because maybe the premiums are more affordable for you or whatever your reasoning is. You need to ask what medical groups are included in the plan. You want to find that out. Then if you like your doctors, you know, you really prefer to stay with them, you want to ask them what plans they accept, what hospitals are in the plan, and does it cover your prescription medication? Some people are on some pretty basic generic medications, but we have a lot of really new brand name medications and you want to make sure that's covered. Or what are your other options if you're not taking that brand name covered medication? Let's see, what are the co-pays and co-insurance, and what are the out-of-pocket maximums? That's really important. Also, you should know with a Medicare Advantage plan, even if a hospital, you're traveling in a hospital, it's out of your network, I want you to know anytime if you have an emergency, you can go to any hospital and it will be covered no matter where you are in the United States. Medicare doesn't work at all outside the United States. So I wanted to here's the Medicare website. I wanted to bring up this Medicare and You book. They don't have the 2024 out, sorry. Not a lot has changed with Medicare over the years since I've been doing this. The premiums change, but I've seen them go down and then up a little. So they stay pretty well. The coverage has just gotten better. The preventative services are better. The drug plans have gotten better. They're confusing, as you probably know, but they actually are covering much, much better. So this book you can order online. It's a PDF, or you can actually order a paper copy. It's about a quarter of it is about what we're discussing now, and the rest of it is just the exact services that are covered. Okay, so what are we looking for during open enrollment? You have a Medicare Advantage plan or you have a Part D plan. Let's start with the Part D. What you want to look at is, have you had a change in your medications from last year? Does your plan you have now still cover your medications the next year? And is there a new plan that could save you money? I'll give you some examples. Sometimes we have a plan, we only take a couple meds, and it's going really well, and your premium isn't very high. So you think, well, I don't need to look at this. You need to look to see if there's something new out that could save you money. Also, you want to make sure that those medications are still in your formulary. Don't just throw the packet away. Don't ignore the mail you're getting. It's really important that you get that squared away before December 7th, or else you're going to be stuck with that plan for the next year. Okay, so that is really important. The next thing with the Medicare Advantage plan, again, you're going to want to just double check with your doctor, make sure that they're still taking that plan and that all your medications will be covered. Because oftentimes you can sign up and the formulary can change as well. They could say, well, you're taking this particular insulin, but now we want you to take this one. Sometimes that's okay, sometimes it could affect you. Doctors can always write exceptions for you and try to push it through, but we try to avoid that because we all know how much time we want to spend on the phone with our doctor's office. Okay, again, can't say it enough. Open enrollment is October 15th through December 7th. That's when you change your Part D and your Advantage plan. We also have extra help is available. So if you're on Social Security with your Medicare, you're on their radar. They know the money you're making. They look at your taxes. So they may send you something that says you qualify for extra help. It's usually a different colored piece of paper. It's worth looking into. Extra help could be like Medi-Cal, where you have Medicare and Medi-Cal, and it pays for your monthly premium. And or it could just be help with paying for drug costs. So you always should be mindful of that. If you have questions about maybe I qualify but don't know it, call Social Security and they will let you know. I like to talk about scams because they will be running rapid pretty soon. So a few things to remember: that health insurance companies must be licensed with the state of California. So if you get a phone call or an email, you want to look to see if they're licensed, or ask them if they're licensed in the state of California. And before you purchase a plan or consider it, ask them to send you information on the plan. If they say, well, we can't do that until you sign up, then you don't want to do that. Don't give out your Medicare number or Social Security number if someone calls you. Even if you've initiated the call, there's other ways for them to verify you. So you never want to give that out over the phone. And also be aware of phone calls and mailings that you didn't initiate. For example, Facebook oftentimes has information about Medicare. Click here, don't do that. Stick straight with Medicare or Social Security. And if you get something in the mail and you want me to look at it, I can look at it for you and work with you on that to see if it's something legitimate. Sometimes they are. Oops, I'm going to back up. I'm not ready for questions. I want to talk about the ads you see on TV. Those are so much fun for me in the last 2 years with answering that question. I should just have a sign that I hold up with a regular disclaimer. So the things you see on TV, they're not scams. They're selling insurance, but they're very narrow. If you call them, typically they're going to want to know your zip code. I think it's okay to give out your zip code because they have to know if you live in California. There's certain areas, like in California, you could only sell insurance in California if you're licensed here. So they'll send you to a California agent. But then they'll ask you for your Medicare number and so on. If you're just trying to get information, you shouldn't have to give your Medicare number. So these plans, what I've found is that when I've called them myself, they're trying to see if you qualify for extra help or Medi-Cal. When you see the advertisements say that you could get your Part B premium paid for, they also have dental and vision and hearing aids, which does happen. But basically, they're trying to get you on their plan. It's never good to not look at all your options. And they are fishing for business. And they've just really inundated, as you know, our TVs all year long. Super fun. So if you have questions about them, you can give me a call. I can go online with you if you need help. But just be really careful when you're shopping for these things. And if it seems too good to be true, it usually is. I would say, when they're trying to get you to sign up to save your Part B, there's very few people that they're reaching that this may work for. Okay, that's it. I am happy to take questions.
All right, thank you so much, Kristi, for that wonderful presentation. We are going to kick off the question and answer portion with some questions from our virtual audience, and then I will go ahead and take questions from our live audience here. The first question is, I have Medicare and a Medigap. If I move to another area, do I need to notify my insurance company?
Yes, anytime you move, you need to notify your insurance company. If it's an Advantage plan, you notify them. You always want to notify Medicare. Also, it's an opportunity for you to change plans. If you leave your coverage area and you weren't able to change plans, when you move, you could change your plan. So with Medicare Advantage plans, once you've signed up for a Medicare Advantage plan, you have to go through underwriting to get back to the Medigap side. If you move out of the area, that's an opportunity to sign up for a Medigap. So yes, you do want to check with your insurance company when you move.
Thank you. Our next question is, I am turning 65 this year and do not plan on retiring until I am 68. Do I need to sign up for Medicare?
So, good question. If you are turning 65 and you're still working and you're covered under a group plan, or let's say your spouse is turning 65 and they're covered under your plan and they are not working, you don't have to sign up for Medicare, Part B or A, but I recommend you sign up for Part A when it's due to you. It's free, and it makes the Part B process very easy once you've made that decision to retire. So the short answer is no, you don't have to do anything, but I recommend Part A.
I am retired and have insurance through my employer. Do I need to be concerned about open enrollment?
No, not the Medicare open enrollment. So some people are fortunate to have a retirement plan through their employer. If you have a retirement plan through your employer, the Medicare part doesn't affect you, but you do want to look for the open enrollment that they're having. So oftentimes there's some companies in this area that their open enrollment time is right now, or it could be right before the Medicare open enrollment. So you do want to review those plans.
Thank you, Kristi. At this time, I would like to take some questions from our live audience. You can raise your hand and I'll come to you with the microphone.
Thank you very much. First question is, on Medicare Advantage Plan, you mentioned an out-of-pocket cap that they include. Does that include a cap on prescriptions as well?
No, it doesn't include prescriptions, unfortunately. Yeah,
Okay.
it's only on medical.
Okay. Second question is timing on Part D. I read somewhere that I'm currently getting health insurance through my spouse.
Mm-hmm.
So I'm turning 65. They're still much younger than that. At some point, they're going to retire, and when that happens, I sign up for Part B. I can sign up for Part B at that time, I understand, but is there a timing constraint for Part D or Medigap
Yes.
relative to that when you sign up to Part B?
Yes. So let me reiterate your question a little bit. So if your spouse is that you're on their insurance, they're going to retire. You have 8 months to sign up for Part B. You probably wouldn't want to wait that long if you're not covered. You could have COBRA for that long. So yes, you want to sign up for Part B within 8 months, and the D, you have to sign up 60 days after your insurance ends. So it's kind of odd. You have to sign up for the D right away, and the B you can wait 8 months.
Okay, so B is 2 months, or D is Part. You said 2 months?
2 months. Mm-hmm.
Okay, from when you sign up for Part B.
No, from when your insurance ends from the employer.
Not COBRA, but when just the insurance ends.
Right.
Okay, gotcha.
Right.
Thank you.
You're welcome. Does anybody else have any questions?
Do you recommend going? I think you said you recommended going through an insurance broker versus just like calling Blue Shield or calling Kaiser or something like that, because you get more choices that way. Isn't that correct?
That is correct. The reason I recommend, I have a broker I work with here in town, and she just does a really good job. And if you call Blue Shield and then you call Anthem and then you call, Kaiser, you're just going to get the information from their company. Whereas if you it's just easier. Online, there's also InHealth insurance. If you want to do it online, they also represent a lot of companies as well.
I wanted to ask a little more. You said the cost of Part B is tied to your income?
Yes,
for
Part
the
B
last
and Part
2
D.
years?
Mm-hmm. They go back every year they go back 2 years.
Is it does the cost vary a lot? Should I stop
Yeah.
looking now?
No. So for example, if you were to retire this year, it would look back at 2021 what your income is, and then the next year it's going to go to 22. Okay, so and then it will go down. It'll fluctuate each year. So for example, some people will get into their 80s. They haven't worked for 15 years. They've maintained that initial Medicare premium, and then they sell a house or they pull money out of their 401k. So the next year it's going to go up, yeah. But then it'll go back down. So it's just something to be aware of. And also that does with Part D. It also affects it, not as much, but it does affect your Part D. Mm-hmm.
Hi, Kristi.
Hi.
Last year you put me on Cigna, and it's tier 6 for my insulin, and it's 0. So
Oh,
is
okay.
that going to continue?
Well, So I think you're on the Cigna Part D plan. So will it continue? Well, I don't know what the plans look like for next year, but I know a lot of people are here about medication, so I'll talk about that real quick. Medicare has done a really good job in the last couple of years covering insulin. It used to be you could pay thousands of dollars for the year for your insulin, and they've gotten so much better. It's much more affordable. There's some new, I'm going to use Eliquis as an example. That's evidently a very good medication. Doctors are prescribing it like crazy for those with AFib and other conditions. And there are some plans that are covering it better this year as they did last year. And also there's a package coming out where they're looking at those brand name medications to cover them better throughout the years as moving forward. I've seen Part D just get better and better every year. So, but if you're new into it, you don't realize that it was worse. I think for me, I've been looking at it for a while. But yeah, insulin is just getting better and better being covered. But again, you do need to look at it every year. If you're taking insulin, you're taking a brand name medication, that's especially the good reason to look at your Part D every year.
The other thing is I did get a letter stating that my Medicare had been compromised. They're going to give me 3-year monitoring. Could you look at that letter? I didn't bring it today.
Sure.
And see if it's authentic.
Okay. Yes, we could do that.
Okay, good.
Is there a site that you can go to kind of see what your Part B is going to be? Because when I retired, and I retired this year, but in 21 I made really, really good money. So I imagine that my premium is going to be quite high. Is there a site that I can go to get an idea what that's going to be?
Yes, the Medicare.gov site. It's very good. If you go to go to Medicare.gov, it'll show the search engine up in the upper right corner. And if you type in Part B premiums, it'll give you a whole list of what the costs are, what it covers, and so on. And that can change every year as well.
Sorry, I have a Kaiser, but I never took a Plan D for drugs. So is it still covered? Or?
Yes. So what you have with Kaiser is a Medicare Advantage plan, because I'm sorry, I assume you have Medicare?
I have a Medicare with Kaiser basic plan.
Okay. So with Medicare, I'd have to look at the basic plan, but I'm sure, I would assume it does. With Medicare, it's a Part C Advantage plan, so it groups your A and your B and your D all in one. Okay. And if it didn't have the D, they would let you know. You'd get a letter saying you should sign up for it or pay additional, but yes.
I did not get that, so
You should be fine.
The other question is that if I have like a profit sharing plan, and if I decided to take that profit sharing plan out about 300,000 or something, not in one chunk, but when I turn 72, I have to withdraw some part of the money. So at that time, my Medicare premium will go up.
So I can't really speak to, that's really a tax question, but it depends on how you're taking it, if it's taxed and how it affects your taxable income. It's something you should talk to a tax professional about. But if it is affecting your income and it's raising your income, your taxable income, then yes, it would raise your premiums for Kaiser it may raise, depends on how they break it down, but it would raise your Part B premium, yes.
And one more question. So if I get like a CD interest every year, does it count as an income?
That's again a tax question. I can't answer that, I'm sorry.
Thank you.
Question on, is the income based on adjusted gross income? Is that
It's your gross income.
gross income, not adjusted gross income?
That I don't know, tax question.
Well, okay.
Yeah. You'd have to look at what the bottom line of your, yeah.
Okay. Question on prescriptions again. Is there a website you can go to where you can enter all your prescriptions in and then it will come up with the best plan for you?
I'm glad you asked that question because I want you to understand I don't sell insurance. I go on the Medicare.gov website, like I could recommend for you to go on, and my job is to know that website and to be able to go on and navigate through it. And yes, you can go on Medicare.gov, and I recommend you set up an account. You can only set up an account if you have a Medicare number currently, but you could still go in as a guest. The only thing is if you take multiple prescriptions, you have to keep entering them each time you go in. Once you have a Medicare number, it actually, the medications you pick up at the pharmacy show up. If you ran it through your Medicare, it shows up on your account. So it makes it easier to go through during the Medicare open enrollment time. But yes, you can go on, put your medications, just check one at a time. You put in the pharmacies, your zip code, and it goes from there. And if you need help navigating and understanding it, I'm happy to do that. Also, Medicare just keeps, I have to give them a lot of kudos. They just keep changing their website, making it better with a lot more information, more user-friendly. Yes.
Question. So if I need a second opinion, does Medicare cover for the second opinion?
Well, so you have Kaiser, so that would depend on the plan. So yes, they will cover for a second opinion, but it depends on the circumstances. So you'd probably want to get a pre-authorization. But through Kaiser, because Medicare is no longer watching out for you, it's Kaiser that is, it would be within the Kaiser program. Now, if you wanted to go outside of Kaiser, that would be on your own, unless Kaiser approved it. Because when you're with an HMO, you have to get pre-approval. Mm-hmm.
Okay. The other question is, if my sister had called ambulance 2 times,
Mm-hmm.
and she got the bill of about $2,000, does the Medicare covers the ambulance bill?
It does cover under certain circumstances. Mostly, there's a lot of variables in it. If it's an if you think you're having an emergency, you should always call 911, call an ambulance. Sometimes you get to the hospital and it's not really an emergency. Then there's a little negotiation that you may have to go to for that. So if it's a transport from place to place, it has to be approved first, and it just depends. So I will say this, ambulance bills are something that come up in my office the most of cases of getting a bill. I also, just going back a little bit, with Medicare and a Medigap, if you have Plan F or Plan G and you've met your deductible, and you get any bill in the mail from your labs, your doctors, your anything like that, I always recommend questioning it, because you shouldn't really have a bill. With Kaiser or an Advantage plan, you're going to have little holes in your plan. So you really need to look at your bills and see what they're charging you to make sure it was billed appropriately. And with an ambulance, bills come up all the time. So it's something you should ask Kaiser about. Why are they charging her that? Oh, if it's Kaiser.
Yeah, if it's Kaiser,
Yeah.
they are asking her to pay $200 for each ambulance then.
Well, that might be their co-insurance or copay for an ambulance. Yeah, so with Medicare and a supplement, there would be no charge. If you have an Advantage plan, that's a line item you want to look at. When I go over these Advantage plans with people individually, we look at those things. We say, well, you know, we're really not expecting to have an ambulance ride. Hopefully no more than 2 or 3 times in our lives. Is that amount of money going to make a difference to you? Durable medical equipment you want to look at to make sure it's covered well. And also hospitalization. With Medicare and a supplement, it's once you've met your deductible, there's no fee when you go to the hospital. But if you have an Advantage plan, and I'm just talking off the top of my head right now, the plans that I've seen are anywhere from $200 to $375 a day for up to 7 days, each time you go to the hospital. So that's why it's nice to have a low maximum out-of-pocket cost if you're somebody who may be hospitalized multiple times. Anybody else? Okay, well that concludes our program. I think you all have a flyer, and on the flyer is my name and my phone number. You're welcome to make an appointment with me if you want a Medicare consultation or any insurance consultation. Open enrollment again is the 15th through December 7th. October 15th through December 7th, and I do get quite busy. I work alone, so also email is a good way to get a hold of me. If you email me at healthinsurance@ whhs.com. It's a faster way to get a hold of me. And, but I always will get back to you. It might take a few days. And I've never not gotten somebody in during open enrollment. If I have to stay late, we have to do a weekend, we'll do it because it's such an important period of time. All right, thank you so much for joining me today, and it's so great to see all of you and all your faces. So, thank you. Thank you.